This conference will now be recorded.
Okay. Guys, Dr. Amar Sobki.
Yes, I'm here, doctor.
Yes, okay. I will choose one of the doctors now. Guys, the first scenario, please, very important. Okay. So, Dr. Anwar, is that Dr. Anwar October group, right? Dr. Anwar. Okay, Dr. Anika Ibnat Chowdhury. Whenever I pick someone, they go offline. Seriously. Okay, Doctor.
Hello, doctor.
Yes, doctor, how are you?
I'm good. How are you doing?
I'm fine. Look, you see this? You see the way she's up. How you do? You know, you feel this happy, positive vibe. That's what we want in the exam. I'm fine, doctor. How are you?
I'm good, doctor, so far. Thank you.
Perfect. So far, yeah. Safety netting. I'm good so far. So, all right. Let's start. Let's start.
Okay, doctor.
All right, guys. Please, everybody, while you are listening to her, write the feedback as well. Yeah, and tell yourself what will I add, what did she miss? So you compare your feedback with my feedback. Okay, anything she does, write down. Okay, 45 years old.
Okay.
45 years old.
Mm-hmm.
Mo Sobhi.
Okay.
Has presented to the A&E with the concern.
Okay.
Presented with a concern.
Okay.
Talk to him, address his concern. Okay, take 30 seconds and let's start.
Okay. Nine.
Let's start.
Yes, doctor.
Okay, guys, can you hear her? Yeah, you can come closer if you want. Guys, doctors are, you can come closer if you want. I want you all to hear, yeah? Dr. Amar Sobki.
Okay, let's start. Hello, I'm Dr. Anika, one of the FY2 doctor in this A&E department.
Hello. Hello, FY2 junior doctor. I don't want to speak to junior doctor.
Okay. May I just confirm your name and date of birth, please?
My name is Mo Sobhi. I'm 45 years old. Go and get me your consultant. I don't want to speak to a junior doctor.
Okay, Mr. Shobhi, I can see that you are quite annoyed. Is everything okay?
Go and get me your consultant. I don't want to speak to a junior doctor.
Okay, I'm definitely going to be calling my consultant. But is it okay if I try? I mean, if we have a bit of chat, so that if you're not convinced, then I'm definitely going to be calling my senior.
Yes,
how does that sound?
Junior doctor, what do you want?
Okay, can you tell me why you're so upset?
Well, I'm very angry because I came to the hospital 7 days back to have surgery. They told me that I will go home same day, and then I went home the same day, and look, I've been having discharge offensive. My girlfriend doesn't want to come close to me. My girlfriend is very offended. She said that I smell bad.
Okay.
Why did I have this infection?
Oh, okay, I'm really sorry to hear that. Now I can see why you are so annoyed. I think I would have reacted the same way. Okay, is it okay, Mr. Shobhi, if we have a chat so that I can understand you better?
Yes.
How does that sound?
Yes, asked me before to have a chat. We're having a chat now. What do you want to say?
Thank you so much. You say that you had this surgery, and then you say that you will be going the same day.
Yes, I had hernia, and they asked me to go home same day, and they said everything is fine, and it's a daycare surgery. I went home same day, but look, 7 days later, I have temperature, and I'm having discharge. Nobody wants to come near me. I smell bad.
Okay, okay. How did the surgery go, Mr. Shobhi?
The surgery went well. but I don't know what happened now. Look.
Okay, okay. I'm definitely going to have a look. Just give me a few more, just few more questions. Bear with me, please. Where you explained about the procedure, about the operation.
Yes, they spoke to me about the procedure.
Were you told about what can be the complications, possible
Well, they
complications?
told me that I might have an infection, but I didn't know that this is how horrible when you get an infection. They said to me, it's not common. And one of the junior doctors spoke to me, consented me, and said, it's not common. You might have it or not, but this is really horrible.
I can see that. Mr. Shobhi, do you have any medical condition?
Apart from diabetes, nothing else.
Okay. Can you tell me more about your diabetes, please?
It's controlled. Everything is under control. I take medication, metformin, and the diet control, and everything is fine.
Okay, okay. And apart from the, do you smoke?
I do smoke, yes.
Can you tell me more about it?
I do smoke.
Okay. What do you smoke?
I smoke shisha.
Okay. Can you tell me more?
What do you mean? Flavor?
No, how many times? How many
I
times you're
smoke 3
having?
times a day for about 10 years now.
Okay. What about alcohol?
No, I'm Muslim. I don't drink.
Okay, okay. And apart from this medication, are
Why
you
am I
taking?
having this infection?
Yes,
Tell
I'm
me,
coming to
why
the.
did I have it?
Yes, Mr. Shobi. Just a few more questions.
No, I want to know. You've been asking few more for half an hour now. Why did I have the infection?
Okay, Mr. Shobi, were you prescribed medication after your surgery?
What do you mean medication? What do you mean by medication?
Were you prescribed antibiotics?
That's why I have the infection. Nobody giving me antibiotics. Nobody
Okay.
prescribed for me antibiotics. Bastard in the hospital. Nobody give me antibiotics. I think that's why I had the infection. Why didn't you prescribe for me antibiotics?
I'm going to explain you that. But before that, were you
I think if you would have given me antibiotics, I would have been better. I want to complain.
Yes, definitely. It's your right to complain, and definitely I'm going to be helping you how to do with the procedure. But before that, I just wanted to ask, were you explained how to take care of your wound after you are after you are discharged?
Yeah, they told me how to look after the wound.
Okay. Did you do as you were told?
Yes, I did as they were told. Yes, yes.
Oh, that's really great.
Give me antibiotics.
Okay, okay. I can see that you are quite upset about it, but I just wanted to ask you about were you taking your medication for diabetes regularly?
Yes, yes.
Okay. You see, Mr. Shobi,
Why did I have the infection?
I'm coming to that, but before that, I'd like to examine you, if that's okay with you.
Okay.
I'm
The
going to be
wound.
checking.
What would you
Yes.
examine?
I'm going to be checking your vitals, your blood pressure, heart rate, temperature. Also, I'll be checking at the site of your wound.
Okay. Okay. Anything else?
Yes, the wound site. Yeah. How is it?
Okay. The wound site infection. You've been given a
Okay.
picture.
Okay. Let me see the picture.
I will send it on the WhatsApp group.
Okay.
Okay.
Yes.
Okay. Okay. Anyway, infection. We're gonna spend time from the 8 minutes. Yes. The wound site is infected. Redness, oozing, discharge, smelly.
Oh, okay. Okay, I have examined you, Mr. Shobi, and your temperature is high. Also, the site of infection there has been discharge, and so you were upset about the fact that why did this infection happen, right?
Yes.
Actually, there can be many factors, and one of the factors. Are you following me, Mr. Shobi?
I am following. I
Yeah,
think
one
it's
of
the
the.
hospital, dirty hospital.
Okay, let me assure you with the fact that we maintain all the high safety precautions while
How
performing
do
the
you know?
surgery. This is our hospital protocol. Before any surgery, we make sure that everything is cleaned and aseptic. Are you following
But
me,
how
Mr.
do you know? It's a big team. Did you do my surgery?
Okay, I don't know, but how about I talk to my how about I escalate this matter to my seniors and we
Why did
can.
I have this wound infection?
Yes, as you mentioned about the fact that you're diabetic, so this your condition is one of the risk factors. Are you getting me, Mr. Shobhi?
Yeah, so it's me. I'm the reason.
No, your medical condition can be one of the reason. However, we are not sure at this point. Do you want me to discuss what we are going to do further?
What are you gonna do?
Okay, so I'm going to be doing some routine investigations, which will also include some blood investigations and infection markers to see. Okay, are you following me, Mr. Shobhi?
Yes.
Also, I'm going to take a swab from the site to see what's responsible for this infection. How does that sound to you?
It sound horrible. Anything else?
Yes, we'll be cleaning this site and be doing the dressings again, and we'll be exploring the site if that's okay with you.
Time is up.
Carry on, doctor. Yes, yes. Okay,
Okay.
anything else?
Yes. As you mentioned that you are having this high temperature. So we are after talking with my senior, definitely I'm going to give you some medication to reduce the temperature. Also, you are having this discharge and pain. So we'll have to after obviously consulting with my senior, I'm going to talk about we can give you some medications, antibiotics. How does that sound?
Yeah, sound good. Okay.
Also, do you still want to complain? Are you happy or you want
Yes.
to? Okay,
Yes, I wanna
okay,
complain.
okay. So I can help you with that. But in the meantime, we'll be keeping in follow up so that we can see how you are
So when can I
improved.
come for the follow-up?
Uh, okay, within 7 days.
Okay.
But I'm sorry, I'm not sure at this point. How about I talk to my senior and come back to you because I don't want to give you any vague answers at this point.
Okay, so
Uh,
you mean the follow-up may be less, maybe longer than 1 week?
no, it may be less than 1 week.
Okay.
Yeah.
All right, doctor. Thank you very much.
Okay. Okay. Are you happy with it now?
Yes, I am. Yes.
Thank you so
Station
much.
lasted for 8 minutes and 58 seconds.
Perfect. I'm happy. I'm happy with her. I'm happy with the consultation. Very happy.
Thank
Yeah. Okay.
thank
Very
you,
happy
doctor.
with the consultation. Very happy. Okay. There are some points, some things here and there, but in general, very happy. Yeah. There are two scenarios. The most common scenarios for an angry patient. The most common scenarios for angry patient. Two scenarios. One of them, guys, I like to give you the key, so you know what are you talking about. One of them is wound infection, and the patient is coming now with wound infection, like me now. I came active or not? Yes, wound discharge, the fever, temperature. I'm not well. You know. Another scenario: a patient had surgery, got the infection. The infection is managed. The patient is okay, but she's coming or he's coming. Why did I have it? Why? It's managed. I'm well now. There is no problem. But she's coming angry and she doesn't know why she had it. Are you following me? So again, an angry patient. Most common scenario: infection after surgery, wound. How many scenarios we can have? Two. One of them, be careful. I'm just highlighting so you don't get lost. One of them, a patient who's coming, already infection there. Infection there, discharge, had surgery, fever, and he's angry. So be careful because in this case, you are managing the condition as well as the anger. You are managing that as well as the anger and the concerns that he has. Why did I have this? However, the other scenario, it's managed, it's treated. The patient is fine. The patient is perfect. She had the infection and she's managed. But why did I have it? So do you want to give antibiotics here? Any painkiller? Anything? No, she's fine. When you assess her, doctor, any symptom? No, I'm fine now. I had the infection, but I'm coming today to know why did I have it. The infection affected my job. I couldn't look after my. But why did I have it? So in this case, be careful. You don't get, because if you are too scripted, you will just give her antibiotic, but she's fine. There's no problem. So, but this will come from the consultation and the assess. She's fine. Clear. So in this case, it's a counseling about wound infection causes, managing the angry patient. No medication, nothing will be given. Are you following me? Why do you tell us this? Because when you go and read your own scripts, you will know. Oh, why did they get? Oh, because this is one is active. This one, no, there's no infection. Okay, so, صلى على النبي. One case, doctor, I had cyst removal from my knee, and I'm coming because I had infection, discharge and fever. Okay, and I'm angry. I want to know why this happened. Why did I have this? That's one station, right? Is it the same as hernia? Same management. Same management. Same management, guys. It's not a new station. How can I, doctor? I'm very angry because I had my appendix removed and I'm having discharge and fever. Same as hernia infection? Guys, my point is deal with them all the same. How can I help you? Doctor, I had whatever, anything. I had any kind of surgery in my body and I'm coming actively. I have infection. It's not new station. Doctor, there is new station. What happened? You know this case of wound infection, but it's cyst. After the cyst removed. Same. I'm sorry. And the wound infection, take the history and the causes and stuff. When you manage antibiotics, you understand? Same. So don't deal. Why did you give us these examples? Because you guys think it's new, but it's not new. Wound infection after cyst removal from the knee is the same as wound infection after hernia removal, hernia surgery. It's the same after wound infection, after ovarian cyst removal, same. You're gonna deal with it the same. Nothing will change at all. Angry patient, manage the anger, talk about the causes of wound infection after surgery, and then manage the surgery, manage the infection, sorry, and that's it. Okay, what about the other scenario where there is no? Same. Doctor, I had cyst removal and I'm fine now. Why did I have it? Doctor, I had appendix removal. Doctor, I had anything. I had lipoma remove, anything, guys. They are all the same. You're not going to even change one word. The only thing that will change that this is the site of wound, this is the site of wound, this is the site of wound, this is anything. Are you lost? So that's one thing to tell you. So now we are not discussing post-surgery infection. We are discussing any surgery, any infection, same approach. Okay. So I said to you, what is the difference? What are the differences between the two scenarios? One of them, you will manage an infection. The other one, no infection already managed. Why do you say, guys, it is important because you get lost in the exam. You get lost. Sometimes you say, I will give you antibiotic. I'm fine, doctor. Why you give me, And then he should be more angry. Yeah, fair enough, I had infection. I'm coming to you to complain and I'm fine. You're gonna give me antibiotics? That will make the things bad. Okay. So now we are dealing with two things. Angry patient plus whatever the station, if medication or not, or antibiotic or not, yeah? Okay. How to deal with angry patient? A patient who's angry. Okay? A word can make me very angry. Right? Any angry patient, you must acknowledge the anger and you must do early resolution. You must acknowledge what? Anger. And you must do what? That's it. These are the two words. Doctor, what's your name? Me? Dr. Roy. Dr. Roy. Dr. Roy. The only two things I would like to tell you about an angry patient: acknowledge the anger and early resolution. Okay, acknowledge the anger. What does that mean? When you open the door of the cubicle and you see a patient sitting like this, acknowledge. Alicia, I can see you are upset. Alicia, I can see you are not happy. Alicia, I'm here to help you. Can you please tell me what's happening? I'm here to make sure that everything is all right. That's what the meaning of acknowledge. Early resolution means I need a consultant. I don't want to talk to you. Definitely we can bring the consultant to speak to you. There's no problem with that. But it's all right if we have a quick chat so I explain things to him. So, don't say, okay, let me talk. So early resolution. Early what? Okay. Give us another example outside the surgery. Outside the surgery for early resolution. You open the door. A mother is angry. Sitting like this. Acknowledge that. Alicia, but in a soft way. Alicia, I can see. Yes.
When the patient tells me why I had this, is it because of me? What should I answer?
Don't worry. I'm coming to the whole station. Don't worry.
Okay.
I'm coming. I'm gonna tell you, even the management. Don't worry. But I'm just now. I broke the station down. I said the station will start with anger or medicine. Anger. Unless you relieve the anger, you're not gonna be able to move to. That's why I'm talking about that anger now. Then I will move to medicine. You understand, Dr. Mona? Don't worry. I'm gonna tell everything. Okay. But I'm trying to
Yes.
move slowly. Move slowly.
Okay.
So
Okay.
the patient is angry. I'm giving you another example outside this topic now. Yeah. The mother is angry. Acknowledge the I can see you are not happy. I'm here to help you. I'm here to make sure everything's okay. Look at my son. My son, I came and he's vomiting on his clothes. And he put himself with himself. That's not good. Not good hospital. Early resolution. I will make sure right now. I will speak to one of the nurses to clean him, change him, make sure everything is fine. I'm sorry about that. Can you please tell me more about it? That's what I mean by early. So I'm not gonna be sitting talking to the mother. What is the color of the vomit? What is the color of the poo? Is it green? Is it blue? Is it black? Is it purple? No, early resolution. So early resolution, according to your situation. A mother is angry because her son was giving a medication he has allergy to. He was giving what? When you open the door, acknowledge the anger. And then what happened? My son, they gave him medication and he has allergy to the medication. Is he all right? I'll make sure he's okay. I'll make sure that, what is he? I understand. Try to show guys. So please. Okay? That's the meaning of. So angry patient in 2 words. Acknowledge and early resolution. After that, always let's move the situation forward. I'm here to help, then the station will start. Can you please tell me what happened to be in a better position? Then the patient will start giving you the story. The what? Story. So, Dr. Mo, today we are discussing wound infection after surgery. So what are the points I should cover? What are the points I should cover? But before I start taking history, please, signpost. Guys, signposting is a very beautiful thing. Only when you hear it, you feel it. Only when you feel it. Very rhymes, yeah? Only when you hear it, you feel it, yeah? What do I mean by that? When you take history, always signpost. Alicia, I'm here to help you. Wound, why did I have it? That's the start. Definitely, we can come back to this bar. Wound infection, I'm now trying to sign what? Signpost now. But look how it will taste. Wound infection can be caused by many reasons. Some factors could be due to the surgery itself. The type of surgery. Like if you're doing a surgery in a for example, ruptured appendix, the wound infection is high. Okay. Some factors to do with the hospital, which is there a chance is the hospital? Why do you defend your hospital? The hospital is clean. I'm dirty and your hospital. No. Can it happen due to hospital? Is there a chance of? Do you guarantee as a junior doctor that the consultant and the nurses and everybody in theater was clean? Maybe there's a new student who's like learning how to. Yeah. So always start signpost. Alicia, definitely I can answer this question, but is it all right if we have a chat? Because wound infection can be caused by many reasons. Okay, some of them is to do with the surgery, the type of surgery, some factors to do with the patient's medical condition, and the other factors to do with the wound care. Have I said anything? The surgery itself, the patient condition, the wound care. So now she knows that you're gonna take history about what? So now you remember the dermatology. Did anybody attend dermatology and DNT? I've done it last week. Dermatology ENT. Anyway, I said to you, any station, 2-3 words. How many words? 2-3 words. So this is station. Angry patient because of wound. So my 5 words, angry patient. Acknowledge and it done. Done. Angry is done. He's not gonna be angry anymore. Don't worry. But show some care and keen and What about the wound infection? Signpost and start taking history. What is the history? 3 words. What is the history? 3 words. What are the 3 words? Surgery, patient, wound care. Surgery. What type of surgery did you have? But if it's written outside, say, I can see you had hernia. How did the surgery go? For how many days did you stay in the hospital? Did you have any complication right after surgery? Were you okay after? That's all question to do with surgery. Okay. Coming back to you, how is your health in general? Any medical conditions at all? Like diabetes, blood pressure? Are you on any medications by any chance? Now I'm asking about that patient. Are you lost? I'm making it very simple. Surgery, ask about the surgery. How did it go? What type of surgery? Patient, medical condition, medication. And finally is the wound. Any advice was given to you? Write down these questions under the wound. Very important. Very, 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 very important. Number 1. Did anybody walk you through the complications of surgery? Did anybody tell you that wound infection is one of the common complication for any surgery? That's under which word? Under the wound, yeah? Number 2, did they walk you through the wound care? Yes, they did. The doctor did not discover. She should have said, what did they say? What did they say? How many times did they say to you to change your dressing? How did they tell you to change the dressing? Did you do as it was told? Yes. Who was it changing it for you? Is it you or someone else? Did you shower while you are having that dressing? Because it can lead to wound infection. Showering, wound, dressing, So are you lost? Now I'm talking about 3 factors only. And I broke them down because wallahi, whenever you read any notes, you will see newspaper. Seriously, newspaper, plenty of things, and you don't know these things. What should I take out of them? What do I need from this? This is what you need. Now, I said number 1 is the surgery, number 2 is the patient, number 3 is the wound infection. Then you can now move right away after you took your history. Now, Alicia, or Alex or Anthony, my main concern now is you. I can see you are upset. You have the right to be upset. But please, my main concern is you, because we want to make sure that you are stable and want to make sure that we manage this wound infection. Yes. So is it all right if we first, but no, don't say manage the wound infection now, because I will examine her. I cannot say manage the wound infection unless I see. So say to her, Alicia, is it all right if we have a look at your wound and check your observation, which I call it what? Examination. Then you will be given picture. Then you will be given, here you go, doctor. They will give you a picture. What to do? Move to provisional? Wrong. Wrong. When you are given a picture, if you want to be beautiful that day,
Describe it
guys,
to the patient.
When you prepare well, wallahi, when some doctors, I see them in the academy and they are very brilliant, very good. I know sometimes, and inshallah, they're gonna pass. The doctor are worried. Everybody's worried. I say, guys, the exam day is your wedding. When I mean your wedding, I don't mean your wedding. We're gonna get married in the GMC. But this is your day. It is your day. You should be happy. You should be proud. You're gonna go there. You're gonna smash the exam. Because what I'm saying, not everybody does. Even you guys, not all of you will do. By the way, not everyone does what he hears. It also comes from practice. And what we say, alhamdulillah, if you practice with others, you will know the difference. You will know people, boom, 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 just dialogue. Now, when you have the picture at the exam, at any picture, describe the picture as if you are looking at that. And that's what I'm going to say. Yes, Alex. Yes, Alicia, you are right. It is wound infection. I totally understand now why you are upset. Yes, there is discharge. Yes, there is redness around the wound site. Yes, now I can see why you are very upset. So acknowledge, as well as when you look at the wound and acknowledge, yes, because Wallah al-Azim, if someone is angry and you tell him, yes, you are right. Yes, after you see the wound, yes, I can see where you come from now. Yes, there is discharge. Yes, there is. It will make you relax. Think about it. Think about it. I use always this trick in my life with my wife. Whenever she's angry, yes, you are right. You are right. You know, you don't even listen. Yes, you are right. Yes, you are right. That's it. She's calm, and that's it. Move on back to something else. So that's good trick. So acknowledge when you get given a picture, and after you get given a picture, and after you acknowledge, then my main concern now is you. I want to make sure you are. Guys, have you noticed that I am making the whole consultation as a talk? Can you notice? It's not like, well, from the information you are giving me, and according to my exam. No. You see, I'm trying to connect history when I move to examination. And then from examination, I look at the picture. Yes, I acknowledge the picture. Yes, I reflect. Yes, I say now my main concern is you. I want to make sure you are. Okay, so is it all right? Number one, admission. She said no admission. She said follow up. No, I will admit the patient with wound infection. Wound infection admission, IV antibiotics. So step one is what? Admit. Step two is senior. You cannot have a patient with wound infection without talking to senior. Step three, follow the structure. You're not going to be lost. Step three is investigation. What are the investigations? Mainly blood. So blood, infection markers, full blood count, and you will take a swab from the wound. And you can even do blood culture. Perfect. So swab from the wound. Step four. So painkiller and medication for the fever and antibiotics. Clear. Step five is perfect. Clean the wound. Change the dressing.
Anji?
Don't forget, clean the wound and change the dressing.
क्या?
Clean the wound and change the dressing.
वो नीचे पड़े ऊपर खत्म हो गए.
Dr. Maha, please mute your mic if possible.
That's why all the course was like, maybe you spend half an hour. Can you mute your mic? The mic, you know, now, you know, like the course is recorded like 1 hour, 1.5 hours. But now, when we open the mic, so clean the wound and change that. Make sure, guys, clean the wound. Am I making any sense? Of course, clean the wound and change the dressing is more important than antibiotics. Not more important, but people forget to say I will clean it and I will change the dressing. Anything else? Yes, there is. Where you are in the station? Where are you in the station? يعني if a patient is coming, complication of surgery, do you need the surgeon to have a look at him? Yes. So you will need a surgical referral. Guys, surgical referral doesn't mean that we will carry the patient on our shoulder and take him to the some. No. The surgeon come down to the NE. Believe him, he comes down to have a look. Yes. Admit him under surgery, send him home. So surgical referral, please. Say, do you agree? Because you don't know the extent of infection, everything. So the surgeon needs to come and have a look because there is a complication after surgery. Clear, guys? And now, after you manage the patient medically, and the patient is not happy, and then you can tell her you have the right. If she's angry, if she's angry, guys. If I'm showing, was I angry till the end? I was. So then she can tell me, I said to her, I want to complain. Yes, definitely you can complain, and we can help you with that. Okay. The doctor said something I did not like. She said, now I did everything for you and everything is fine. Do you still want to complain? No, guys. I want to complain, yes. I want to complain? Okay. I want to complain? Okay. Don't tell me. I saw to doctor. Do you still want to complain? If the patient mentioned the word 100 right away, you say definitely you have the right to complain. Don't say
doctor,
to her,
please.
Yeah.
Also, she said, did they prescribe you antibiotic after the surgery?
No. Yeah, I am coming now to her feedback. I wrote it here, and I wrote the word here, antibiotics. I'm coming to it now. Yeah, I'm just finishing the station, and so when do I offer the complaint department? That's a question. When do I offer a doctor? If you are talking to the patient until the end, the patient is not. You can see the patient is not. You can offer it without him saying it. Again, when to offer complaint? If till the end the patient is offer. Don't worry. What is the second option to offer complaint? If he said, I won't, please right away, guys. Don't tell, you know what, I told you I'm going to give you antibiotic. And I told you I'm going to clean it. Yani I'm going to, do you still want to complain? No, doesn't work. I want to complain. Don't say I'm happy because I'm happy to complain because that doesn't suit the situation. Definitely, we can help you with that. Dr. Anika, are you following?
Yes, doctor, I am.
So right away, I want to complain? Yes. So if the patient is very angry, do you offer? You can see he's angry. Do you offer? Yes. What if the patient, you spoke to him while you are talking, the patient is fine. So are you satisfied, Mr. Andrew? Yeah, I'm satisfied, doctor. Everything is okay. Do you want to complain? Over complain? No. Do you understand what I just said now? Online doctors, if I'm
Doctor, I have
talking
a
to the
question.
patient, sorry?
I have a question.
Can we finish it after I finish the whole station?
Okay.
So
yeah.
if I'm offering, if I'm talking to the patient at the end is happy, satisfied, do you want to offer him complaint? No, you don't. So you offer complaint only if he's still angry. And the second option, if he said, I want to complain. But by the end of the consultation, if he is okay, you can see he's okay, he's fine. You don't offer. Doctor, is there any situation if he's okay and I offer complaint? Are there any situations if the patient is okay and I offer complaint? If you hate,
I hate my colleague.
Yes. If you hate your colleague, then you sure you don't want to complain? Are you sure? Think about it. Yes. Now, this is the situation if the patient is actively having. What if the patient, the other one, no infection? No infection. She's annoying. She just presented. She had surgery, cyst removed, and she had infection, and she's fine now. She got treated, she got managed, but I'm not happy. Why did I have it? Annoying patient. So walk her through the story. Walk her through. First of all, acknowledge the anger. Early, I'm here to help you. Definitely will try to get out of this. Then, doctor, why did I have it? That's the main concern. So always make sure you ask about that. Are you okay now? Any symptoms? What are the symptoms of any wound infection? Pain, fever, discharge. That's any symptom, any wound infection. What are the symptoms? Pain, fever, discharge. No. She's free. She's fine. The story, walk me through what happened. When did you have it? Yeah. What happened after I had the infection, doctor, and it was managed, doctor. I went to home, but why did I have it? So she's fine. So your history is how many factors? 3. Surgery, patient, and wound care. You took the history, and then it's all about, well, after taking the history, well, I can see that, yes, there is such and such, yes, there's such a, it could be such and such, but we do such and such. But make sure you do not blame the patient. Don't say it's your fault. And don't say the hospital is 100% okay because, well, it could be the hospital. But we try our best to make sure that everything is aseptic. Can you guarantee? So always say, it could be the hospital, but we'll try our best to. So in this case, I've done with the doctor. If I said why, after history, it could be the hospital. There is a risk, but we try our best to make sure that that doesn't happen. However, there are other risk factors, like I'm sorry to come across that way, but the fact that you have diabetes, it can lead to this. You get me? But always don't blame only her, or because she could be diabetic, but it was the hospital. Do you agree with me? Yes, and nobody can guarantee the hospital. You know the antibacterial spray? They always write protection 99.9. They never write protection 100% because you can sue them. Yeah. anything, any disinfectant, protection, 99.9. Why? Because if some you are the 0.1, you are unlucky. Huh? Yes, you are the 0.1. Anything, anywhere. Never, you never find something 100%. Never. Only in Egypt, maybe Pakistan, India, they write 100% of brother. So because you know brothers doesn't have rights, and if he comes back, no problem. But in UK, 99.99, and then you are in the 0.1. So okay, are you lost? So these are the two stations. These are the scenarios. A patient is having he had ear surgery, infection, anywhere. It's the same. Okay, don't say it's a new station. Why? Because you know we had a hernia, but this one is cyst. Same wound infection, same factors, same thing, same everything. Okay, and always explore about who cared, who looked after the wound, what advice was given. Very, 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 very. If you don't ask where you told about complication of surgery, highlight this question, highlight it. Okay, and acknowledge and okay, because you are having an exam very soon. At any time you feel that you are not benefiting, you can go right away. That's not. I don't get offended if someone is going. For example, maybe you are sitting, and if I leave, they will be looking at me and they will see. No. You know what's better for you. These things are repeated. You know about them. You know benefiting. You can go. It's fine. I'm fine. Because even if there's nobody, I'll do it for the online book. Next station is very.
I'm sorry, Dr. Mo. I just don't understand what exactly today the infection is not active. Should I just address her anger and that's it? Or should I do anything else?
For what? For what?
For a patient who came after surgery, but there is no active infection. She's not infected anymore.
No, you will address her concerns. She's angry. Okay, address the anger, which is in fact very difficult. He's saying just address the anger, that's it. It's difficult to address an angry patient. It's not easy. Okay? And she's gonna have concerns. Why did I have it? Then you need to take history. And then she's angry. Pulse, then so it's still a station. It's not as easy as you think. Oh, she's angry and that's it. No problem. I just yeah, because no angry history. Why did I have a hospital? Shit, hospital. If she keeps talking, do not ever stop her. If a patient's talking, don't. Please, guys, listen. Please, listen. You understand? Please, don't ever. No. Please, always in the exam, if the patient is talking, please. Some people say, "Oh my God, bastard, he's gonna finish our time. I have 8 minutes." It says 5 is gone. No. Some stations they assess your listening. Wallah, some station they bring a patient to talk. Wallahi, and they just assessing your listening. And doctor and this and then I went and then I came and then. All right, but when you say all right, nod your head to show him that you are listening and always actively try to see what is gonna be important for you after he finishes. So please do not ever, please, if he's talking for 5 minutes, let him talk. Okay?
Dr. Mo?
Yes, doctor?
The patient told that the doctors didn't give me any antibiotics after the surgery. How can we respond that?
You should not ask, doctor, were you given any antibiotics? Because it made me angry. Especially if I wasn't. I will be, oh my God, they should have given me and they didn't. So always, were you given any medication to take home? That's it. Not antibiotic. Or what was the plan after going home? Was it only changing the dressing, or were you told anything else? Were you given any medication? That's it. If she said to you, like what, doctor? Like what medication? I said to her, like what? Antibiotics. No. Say like painkillers, for example. Painkillers, medication. So do not go there, because if you go there, I did. What I did with her is it logic? Oh my God. Oh my, because everybody knows that antibiotic should be given after surgery as a person who's not a doctor. So if you say, oh my God, like in Egypt, This doctor don't go there. Why? Because he doesn't give antibiotics. He's not good. He's not good. So maybe you're dealing with such patient like, oh my God, he didn't give me, he's the reason why this. So let's move because we don't want to waste too much time. By the way, what I've given you is a topic. Is a angry patient, post surgery wound infection. Deal with it. I hope you understand it now. Wallah, if you read any notes now, it will make sense. You will just flick through it. Flick, you know. Okay, let's move to
Dr. Mohammed.
Yes.
Sorry, one question. I always tend to say that I want to see the wound or any kind of infection if patients say that I have this and that. So I don't know if it is okay to say that, like, can you please show me your infection, or should I just continue with the
like to examine
story
the wound.
taking?
Always say I would like to examine the wound.
No. My question was, I always say this before taking the history.
Say what?
For example, if a patient comes and say that I have a wound infection after surgery, then I would say that, can I see your wound? And then I'm going to take the history.
Yes, you can. She's saying, can I do that? If the patient said, I have wound infection, can I say to him, can I see the wound? Of course, yeah.
Maybe she's saying that she says that before taking history.
Yeah, yes. Right? She can, but she should be aware that she should take history. You know, like, yes, of course. That's actually natural. Can I look at it? Understand? But if the patient said to me, I think I'm having wound infection, I would not jump to examination. I would say, why do you think so? Why do you think it is? What symptoms did you have? Or what symptoms do you have? And then finish my history, then go to examination. I would not jump to examine. No, doctor, I think I have wound infection. I'm sorry that you're going through that, but can you tell me why do you think it's wound infection? Well, because I have pain. Where is it exactly? When did the pain start? Anything else? Discharge, track. Anything else? Fever, explore. Then, what surgery did you have? Patient's factors, wound factor. Then examine. Guys, let's move on because we have 215 doctors. If everyone has a concern, I'm gonna finish one station and go home.
I have one general question.
Okay.
Dr. Mo,
I hope you don't think I am rude. I don't mind. I have 2 hours. If I do one station, I'll go home. So for me, it's fine to finish one station in 2 hours. But I have plenty of things, and I don't say no to anybody about questions. I cannot say no, but at the same time, you should yourself say, well, we need to move on to take more. Okay? Anyway, yes, doctor.
One general question for all patients when we admit in A&E. So we are referring to the department like this one. We are referring to surgery.
You do not admit in A&E. There is no admission, but when you admit, it means that you're going to be kept
surgery. Yeah, based on the department we refer there, and in the safety netting, should we mention anything in the safety netting?
Yeah, safety netting, like anything else, like if you don't feel well after the treatment, if you know, like any safety netting. Why did she come with wound infection? So safety netting, wound infection. If it's not improving, if it's still discharging and oozing after, you know, and if you're not getting better. Anyway,
but still patient is in the hospital. Still we have to ask.
Yes,
if
yes,
you feel drowsy or anything, let the nurse
Why?
know.
Because the patient needs to be safe. That's basics. Safety netting in the hospital. Yes, because the patient will feel the symptoms before the doctors. So I need to tell him what to look for. Next station, guys.
Thank you.
Yeah, no problem. Next station. Guys, I hope I don't come across as rude, but I want to give you as much. I don't want to come and give a station and discuss it and go. I just want to give you as much. Write down the next station. I consider it as one of what we've done is a topic. Now this is another topic. Topic. What I'm going to say now is a topic. Type of stations is a type of station. Is it important? 100%. Write down the station. I will never discuss anything that's not important for the exam. Just get it down. I'm gonna give you something to just like show off that something. No. Relevant exam things. Okay, write down. 63 years old. Larry King. Larry King. What about him? He went, or he was referred. He was referred from was referred. He went to the Wellman Clinic. Do you know what Wellman Clinic is? A clinic to go and make sure that I'm well. Wellman Clinic. Well woman clinic. A clinic to just check up clinic, yeah? Where 2 weeks back. He went how long? 2 weeks back. Where he was diagnosed high blood pressure. Where he was diagnosed what? High blood pressure. All right, 2 weeks back he was diagnosed high blood pressure. And he was started on medication, Ramipril. He was started on Ramipril, 1.25 mg once daily. Okay. A week later. What do you mean by a week later? So he was diagnosed how long ago?
2 weeks.
2 weeks. A week later. On his first follow-up, what happened? Blood investigations were done and they were all normal. What? All what?
Normal.
Apart from. So guys, write down so you have the question in a systemic way. First follow-up, all normal. Apart from, the EGFR is 100. So that's his first follow-up. All right. Yeah, 100. The first follow-up was 100. Blood pressure was measured and it was 160/90. Dr. Am, you can go, brother. Is that tomorrow's your last day? Yeah, I'm gonna be here tomorrow. So حبيبي ما تحرمش منك عسلية. I love you. So the blood pressure was high after the first follow-up, and what else? EGFR was 100. On his second follow-up, bloods were done, all normal. Okay. What else? EGFR was 60. (160/90). What does that mean? Blood pressure was measured 169. Guys, do you have the question arranged in your brain? By the way, one of the most important things for the exam, Dr. Roy, is understanding the question. Where you are, what happened, when was he diagnosed, what was he diagnosed, in the follow-up, what happened, what was found. Understanding the question is the key for passing the exam. Okay? So do you understand the question? Okay. He was referred to the GP. Wellman Clinic is one thing. He was referred now to his GP, a GP. Talk to him, address his concern. He was referred anywhere, but GP, nephrologist. The only difference that will make is, am I going to refer or not? Online doctors, are you lost? He was referred. Now you are here, but the referrer. عم بخ بقى. Today, he's in the referral. Talk to him, address his concern. Have you seen this question before? It's very important. No, it's very important. Good job. If you have not seen it, it's good, because it's a very, 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 very important. Very important question, and it is a group of questions. Whenever you have Wellman follow-up, second follow-up, Wellman second, be careful. Okay? Write in brackets medication side effect question. Dr. Mo, but you always tell us about the medication side effect question. This is a different style of medication side effect. Ramipril is the cause, but you cannot say Ramipril is the cause. Yeah. Hi, how are you? Yeah, doctor, I was diagnosed. The cause medication. Review medication. No. You understand? So I don't know anything yet. Okay. Okay. How many problems do we have in the question? How many problems do we have in the questions? Scripted doctors will be lost. Wallahi, this question will be lost. Because that question is in the script. By the way, it is in all scripts. It is. But people scripted, if they know the script, if they remember it, they are good. If they don't, what if halfway they forgot? What is that? Wallah, they stop because they don't know how. No. This question now and all similar type of questions, medications effect, follow up, patient, come, boom, done, din. I don't want to miss anything. Okay, let's do the station first with someone who has courage to do it. And then I will give you a structure that you will never ever see in your life. I promise you. I'll give you something in this type of stations. Dr. Amarwa, you will be impressed. Oh my God, how come I will follow this and you're not gonna even miss that much from the station. And I promise you, you don't need to study. If any doctors, 218 doctors online, and all of you guys, if you have to study this station after you leave the academy, wallahi, free mock. That's how much I believe you're not gonna have to study these type of stations. You're gonna watch it here and go home. That's it. The branches, this type of stations, done. This station can be the same but inside. This station can be the same but anything same. Okay. Anybody is willing to do it, and then I mean who like can do it, and then don't worry, we have problems all the time with the stations. 8 minutes and then I start giving the station. Anybody is willing from the doctors here sitting in front of me? If anybody is willing, you can come here now. Yes, brother, come. Danny, yes. Yes, Danny. How are you, brother? Fine. Sit down and let's, I want you to raise your voice a bit. So I want online doctors also to hear Danny. Okay, come closer. Okay. A bit closer, but don't worry, I'm not gonna. COVID policy. Come, don't worry, brother. COVID policy is COVID friendly academy. Anyway, so Danny, Dr. Amar Sobaki.
I'm here, doctor.
8 minutes, brother. 8 minutes, and I'm here. When is your exam? 12th January. 12th of January. Yeah. You know, huh?
He still has a lot of time.
You see, when I said to him, it's so funny that every country has its own accent. Wallahi, I love it because I have my accent. You know my Egyptian accent. Pen and paper. We don't have P and B. We don't have TH. TH all S. Yeah, I think. You know, that's our accent. And when he said, I said to him, when is the exam? He said, 12 January. When is the exam? 12th January. There is no 12. He said 12 January. 12 January. How are you? Fine. You know I'm joking, yeah? Yeah. Anyway. You can. Yes, anyway.
Dr. Mo, this is Hindi accent.
Sorry?
This is Sindhi accent.
Sindhi accent. Yay! Yes, let's start, guys. Write your feedback. And I will impress you, inshallah, after we do the station with the structure. Switch off your camera, Dr. Hala. We can see you. Quickly switch off. Open in case he doesn't know. Yes, doctor.
Hello. My name is Dr. Danish and I'm one of the junior doctors in the GP clinic.
Hello, Dr. Danish.
Can you please confirm your name and date of birth?
My name is Larry King and I'm 65 years old.
Is it okay if I call you Larry?
You can call me Mr. King.
Please. Okay, Mr. King. I'm good with that as well. So, yes, Mr. King, what brings you here today?
Well, you know, it's my partner. I've got a partner that is very caring. I always tell my partner, I don't like to go to doctors because doctors make things complicated. But anyway, She advised me to go to the Wellman Clinic for a checkup. As I expected, I went there and they said you have high blood pressure. They give me medications. I'm using the medications, and I don't know. I followed up first time. The blood pressure is not going down, and I was using the medication fine. Then another follow up. They said, well, you need to go to the GP, and now I'm here.
Okay, I'm glad that your partner is very caring and she's insisting.
It's not she. I'm gay, doctor. It's he.
Okay. I'm glad, yeah, that you are having a caring partner, and yes, I can see from my notes that you went to the Wellbeing Clinic and you were prescribed one of the medications for the blood pressure.
Yes.
And in the last two follow-ups, and the blood pressure was still a bit higher.
Yes, yes, yes.
And yes, so I would like to have some chat in order to know more about it. Is it okay if we proceed?
Yes, you can, yeah.
Okay, so was there anything for you that, apart from your partner caring, that made you for that visit to
my partner?
Okay, partner. Okay, so can you please take me to your general health, like
fit and well? I don't have any issues.
Okay, how about your diet?
I eat healthy. I love my food.
Okay.
I eat healthy.
What do you mean by healthy?
Healthy means I love my pizzas before bed, and I love my Egyptian food that my wife can't cook, but I do make my own way like duck. I love duck. Okay. And I love bread. I love rice. My main meal. I drink Monster because it keeps me going. I love sugary stuff. I love sweet chocolate. Yeah.
Okay, so you mentioned about your wife. So,
yeah. Why?
You mentioned about your wife, and you said you're one of the other partner were caring about you, and
just one partner. carry on. Do the one.
Is it the wife or
active listening? Yeah. But wife. Girlfriend.
Multiple wives in our countries.
Okay, apart from this diet, do you exercise?
I hate exercise. Don't like it.
May I please know why do you hate it?
Nobody likes it. I mean,
Okay.
Nobody likes to do exercise stuff, walking and yeah.
Do you smoke?
I do, yeah.
What do you smoke?
Smoke shisha.
You shisha?
Yeah.
And how many times do you smoke in a day?
No. Once a week.
Once a week. Okay, since how long you are smoking?
About 3 years now.
Okay, how about alcohol habits?
No, I don't drink alcohol. I'm Muslim.
Okay, so is there any diagnosed medical condition apart from high blood pressure?
No.
Nothing. Are you on any medication?
No, just Viagra.
Okay. How about allergies?
No allergy. No.
Any family history of high blood pressure, high sugar?
No. Everybody, their sugar is good, their blood pressure is good.
Okay, if you really don't mind, may I know about that? The reason behind taking your pill like Viagra?
Yeah,
really know about the reason behind it.
The reason behind Viagra?
Yeah,
for my hair care.
Okay. Well, as you are here, I would like to check your blood pressure again.
Yeah.
And let's see any finding. Is it still high?
160/95.
Okay. Well, Mr. King, I went through your brief history and I checked your observations. And I will order some other tests as well, like your ECG and your cardiac markers to rule out any cardiac compromise.
What's a cardiac, doctor?
Heart.
Heart.
Heart
Okay.
racing, yes.
Yeah.
So, based on your history on the examination findings, like you said, you have pizza, you can take pizzas, you do not exercise, and you smoke shisha as well. And on my examination, I found the blood pressure was quite high. Still, it's quite high. It's very alarming, and there could be the reason. Do you know what could be the reasons leading towards this high blood pressure?
The lifestyle modification, the diet, the smoking.
Okay, I'm glad that you know about
no
this.
exercise.
Yeah. Have you tried cutting down to it?
No.
You haven't?
No.
Okay. Well, we do have some certain lifestyle modifications program as well, like quitting your smoking, and we can, arrange an appointment for dietitian. Because I believe you are taking medications. Are you compliant to it?
Yeah, I am compliant with them.
Okay. So you are taking this, still your blood pressure is not there. So diet and exercise plays the major role in controlling your blood pressure. Are you getting me?
Yeah, I am. Yeah.
Okay, so you should. I highly advise you to. You should cut down your junk food like your pizzas, like monsters, and your smoking habit, smoking shishas. Because if you take the medications only and you don't care about your lifestyle, it's maybe it's not gonna work here. Are you getting me? So
Yeah,
is
yeah.
there any
2
concern?
minutes remaining.
2 minutes remaining. Don't worry.
Okay.
Is there any sorry?
Is there any other concern I can offer?
No. No.
Nothing else.
No.
Okay. So how about thinking about smoke, cutting the smoke?
Yeah, I can think of it. Yeah, I can think
then
about it.
we can refer you to the clinic which offers multiple options for the cutting of the clinic. How you feel about this?
I feel good.
Okay.
I feel good.
Okay. And we can start exercise, like you can start it from home.
Yes.
As well. Okay.
What do you mean from home?
Yeah, you can start for 10 minutes in your home. You can find a suitable place around home. You can start from the 10 minutes and then you can gradually
Start what in 10 minutes? Exercise in home.
At home or around any places from 10 minutes.
You mean walking at home?
At home or around home, you can find another place for the exercise. Just a little bit, and you can gradually increase it. Is it okay?
Okay.
And I will arrange an appointment with a dietitian who will take care of your diet as well.
Okay.
Will that be all right to you?
All right.
Is there anything else I can offer?
What about my EGFR? That's fucking 60. I'm gonna 60. EGFR 60.
Okay. Okay, I can see it's a valid concern that it's quite high.
Anyway, I love this way. He looked like a doctor. He looked, like sitting, like very cute, He's like me. His belly is forward and belly. Seriously, it's like a proper GP. Seriously, I'm the same. Don't worry. I'm the same. Yeah, sitting serious, cute, on his hand, in his belly. So how can I help you? So how's your diet? So you look like a GP. Communication skills good. Talking nice. Fluent or not? You can tell. He's fluent. He's talking. His English is good. The consultation is. Some things like, why do you use Viagra for?
Because it could be a risk factor for the high blood.
It is risk factor. Not it could be. It is risk factor.
It is risk factor. That's why I want to dig in.
I know, but digging what? Viagra. Why do you use Viagra for? يعني seriously, it came as, why do you use the Viagra for? Like that's too much exploring.
It could be.
The second question: how is the Viagra affecting your life? Seriously, no, you cannot ask this question.
Any problems you are taking?
Sorry?
That could be a news station.
Yeah, it is.
Use of Viagra.
Blood pressure. Why do we expect blood pressure? Sorry, headache due to hangover, and not blood pressure or headache due to Viagra? Can it happen? News station. Viagra. Patient is coming, headache.
And then this question.
Everything. Yes, everything is negative apart from.
A stressful life can lead to the high blood pressure as well.
We know that. I'm just saying the word, I mentioned that I said Viagra in the middle. It is a risk factor for headache, for blood pressure, for everything, for heart problems. Yeah. Anyway, good. But you totally forgot what? By the way, he forgot half the station.
Yes.
Okay. No, half of it. Half the station is gone. Okay. Dr. Mo give us a structure, because we are lost and we need to make sure that this is covered. By the way, it is a type of station. I'm not going to discuss one station, but by making you understand, Doctora, what's her name?
Dr. Ashwarya.
Dr. Ashi, who said Ash, Dr. Ash. By making you understand this, you should apply it in any station. Guys, please, that's my way. I hate, because nobody will remember everything and you'll be lost. So let's give you the structure. Okay?
Can I go there?
Yes, you can go there anywhere. You can go anywhere. I told the GP, can I go there? Yeah. Danny, I love you. I would not be comfortable joking with anyone. Only people I love. So that I know that they're not gonna be,
Yeah, it's okay. It's okay.
Yes. So today, brand new structure. Maybe some have heard it from me before. Sorry, can we get this tissue on the desk here? you don't mind. After the traffic light, turn left, yeah. Thank you very much. Thank you. So we will do something very. We're gonna play a game now. Nice game, okay? Nice game. What is the game? Okay. Doctor, come. Yes. Don't worry. You're not gonna do anything. You're not gonna do a station. Don't worry. No, bring your paper. Sit down. Read the question to me. And all of our, by the way, is there a copy of the question in the cubicle inside? Yeah, there is a copy, yeah? Read the question to me.
Okay. 33 years old.
63.
60, sorry.
Yeah.
63 years
63.
old.
Write that word. Write that word. 63. 63. Yeah. Years old. What?
Larry King.
Larry King. Leave it. Yeah.
Went to the Wellman.
أيوة. Went to where?
Wellman.
Write that word. Wellman Clinic. Okay. Carry on.
Where he was diagnosed by high blood pressure.
Stop. He was diagnosed what?
High blood pressure.
Right. High blood pressure. Okay.
Started on Ramipril.
Started what?
Ramipril.
Write the word Ramipril, which Dr. Danny didn't ask about it. I will tell you now what do I mean by asking in the same place. Yeah. Ramipril.
Once daily.
Once daily, 1.25. Yeah.
2 weeks ago.
2 weeks ago, that, yeah. Then.
Okay. Then a week later.
First to follow up, what happened?
Blood investigations
all normal. You want to write it down? No.
The
yeah.
EGFR.
أيوة. Write EGFR.
Okay.
Right.
100.
Normal. Yes. Okay.
Yeah.
Guys, don't write it now because it was normal. Don't write it. Don't write it. Okay. Carry on.
Okay. Blood pressure 160 over
so,
90.
Blood pressure high or not?
High.
Write it down. Blood pressure 160 over 90. Yeah.
On his second follow-up.
Second follow-up, what happened?
All blood are normal.
Do you want to write it?
No.
No. Carry on.
EGFR
yes.
Is 60.
EGFR 60. Write it down. No. Carry on.
Blood pressure is 160 over 90.
Write it down. 160 over 90. Yes. That's it. Guys, what did I do here? What did I do now?
You took out the positive.
What did I do? I took out the positive or abnormalities. Wallahi, after we do this structure, you're not gonna even forget little thing. Okay. So 63. Give me one word. One word opposite. Now I'm gonna exchange. I'm gonna what? Exchange. Can you use Egyptian pound in UK? Can you come to UK with Egyptian pound? No. Can you go to Egypt and use British pound? No. Yes, you can. Yes, you can. They will love it. Dollar, or British pound, you know, and they give you, I need dollar. You know, you understand? You can. So my point is the exchange rate now. So 63, give me the exchange rate from our currency, Dr. Mo's currency, our currency. 63. Give me one word. Flows. Flows.
Old flow.
Flows. 63 flows. Do you agree?
Right.
Now 60, any 63, you should think of cancer.
Right.
Can this patient actually have cancer? Some EGFR going down, kidneys going down, kidneys falling. Can it be cancer?
Yes.
Guys, so right flows. What is the second word? Wellman Clinic. Give me one word. Not one word, 2 words. What happened? And why? So why, and what happened? That's it. That's it, doctor. That's it. I don't want anything else. So why did you go to the clinic? And what happened? Doctor, they did this, they did that. You know, the chat. What happened? What is the third word? Go down. High blood pressure. He was diagnosed. Right.
Symptoms of blood pressure.
Write the word symptoms of blood pressure, which means Did you have any headaches, any blurred vision, chest pain, symptoms of blood pressure, complication of blood pressure? Symptoms and complication. What do you mean by that? By any chance, did you have any headaches, any chest, any blurred vision, any chest pain, complication, any weakness anywhere in your body? Well, symptoms or complication. Symptoms, headache, blurred vision. Complication, it could be heart attack. It could be that he had weakness, stroke. So that's why I'm asking any chest pain, any weakness, any heart racing, any blurred vision, headache. That's it. What is the word after that? He was given what? So write down opposite ramipril. Yeah. What is the dose? Did you use it as it was prescribed? A medication. What question can I ask about medication? Any medication? Compliance. So compliance. So right in front of it, since when it was prescribed and compliance. What is the second word? What happened after the second word? High blood pressure is still high. Stop. Stop. What can cause high blood pressure even though the patient is on medication? DESA. DESA. What does that mean? What does that mean? What does that mean? The patient is still on medication and it's not controlled. I should think of DESA. No. You understand what I'm doing here? So DESA.
Can you please turn off your mic?
Guys, the mic, please. The mic.
Dr. Tariq, can you please mute your mic?
Dr. Tariq, your mic is on.
Leave it on and then suffer like this. So blood pressure is still high. What to ask about? DESA. That's it. DESA. EGFR is 60. EGFR is, which means the kidney is failing. So number one, opposite this, symptoms of kidney problem. Symptoms of kidney problem. Number two, causes of low EGFR. So EGFR is going down. Yeah. So I will think of two things to ask. The symptoms, the presentation. Is it low EGFR, low kidney problem? Kidney is not is failing with symptoms or without? Do you understand? So symptoms, exactly what we did with that. High blood pressure, symptoms, complication. This is the same. Symptoms of kidney problem, causes of kidney problem, symptoms of kidney problem. Any facial swelling, swelling in your hands, swelling in your feet, problem passing urine, blood in urine, pain while passing urine. Do you agree with me? So these are the questions under symptoms of kidney problem. You see what happened with him. Plenty of things missing. Agree. But now,
Dr. Jawad, can you please mute your mic?
Jawad is listening to Asada, Egyptian singer. You know, and okay, so
Ahmed. Dr. Jawad, can you please mute your mic?
بصي people polite. Dr. Jawad, can you please mute your mic? Dr. Jawad. You know that. So EGFR is 60. I will think of two things. Symptoms, is it presentation or not? Number two is causes. So symptoms we know. Mr. Andrew, did you notice any swelling in your face, hand, legs, feet? By any chance, do you have any passing urine, blood in urine? Okay. What about the second thing, which is causes of low GFR, which basically causes of kidney problem? One of them we think of, which is the medicine. One of them is already that we think of that medicine. That's one cause. But could it be any other causes? In one word. Tell me the other causes in one word.
Dehydration.
Medical conditions. Perfect. Medical conditions. Do you have any medical condition, Mr. Andrew? Like what, doctor? Like any problem in your kidney previously, any diabetes? Do you understand? So under the causes of low EGFR, write down in one word, medical condition, and tell yourself what before medical condition is to ask about other causes. But what are the causes I know so far from the station? Could it be the medication, Ramipril? Yes, side effect is EGFR low. That's one thing. What else is going to be the cause? Because I'm going to counsel him. Perfect. The blood pressure itself can cause problem. So now I have two causes: the Ramipril and the fact that he's hypertensive, plus other medical conditions. Clear, guys? That's my history. That's it. This is my history. Nothing else will be missing. If you bring these questions together, it is your history, and you ask them as they are. The only thing that you're not going to start with is flows. Mr. Larry, any weight loss? No. I will start. I can see from my note that you've been to. Well, why did you go? Any reason? Any specific reason? What happened there? I can see that you were diagnosed. Any symptoms? Did you have any headaches, blurred vision, chest pain, weakness? Yes, no. Any medication prescribed? Yes, doctor. They gave me Ramipril. Ask him. Those, did you was prescribed or not? Mr. Larry, in your first follow-up, we noticed that your blood pressure was high. Mr. Larry, even though you were on medication, there are other causes of high blood. Is it okay to have a chat? Yes. Diet, exercise, smoking, alcohol. You see, I signpost to tell everybody. I'm now asking this because it could be a reason why, even though he is on medication. And with this, I can ask flows because I said don't start with flows. Do you know why I said don't start with flows? It's going to be odd to start with flows. That's the only reason I said it is there, but I'll ask it with this. I hope you understand what I'm saying. Anyway, then I will say to him, in your second follow-up, anything significant? Yeah, doctor. They said the EGFR. Always assess his knowledge. Do you know what EGFR is? Because he will not know. Say to him, it's a kidney marker. It was low, Mr. Larry King. So, Mr. Larry King, it's okay to ask you about some question that would be significant for me. Any symptoms like of kidney problem, like make it logic, like natural. Once you reach EGFR, tell him. Do you know what EGFR is? No, I'm saying you're gonna ask him. Do you know what EGFR is? He will say, well, no, doctor, I don't. It is a kidney marker. It's quite low, so maybe there's a kidney problem here. So it's all right if we have some questions, ask some question to check if you have any symptoms of kidney problem or not, and then start asking about the symptoms. Swelling face, swelling hand, swelling feet. So what I do, signposting in order to join the phrases together. Yeah. Also, Mr. Larry King, in general, apart from the blood pressure that you were diagnosed, any other medical condition, which I mentioned the causes of. So I asked him, are you normally fit and well? Any healthy issues? And that's it. Then examine. Then provisional diagnosis. In the provisional diagnosis, what would you say to Mr. Larry King? You will say to him, well, I can see from the follow-up that there are two issues here. The fact that the blood pressure is still high, which I'm suspecting could be a risk factor, which is the lifestyle. That's a provisional diagnosis. And also the fact that the EGFR is going down, it could be the medication. It could also be the fact that the blood pressure is high. Clear, guys? Or it could be. Can it be?
Yes.
Yeah. So is it okay? And then start. This patient will need what? Review medication. But before review is senior. Senior number 1. Review medication number 2. Referral to who? Nephrologist, kidney specialist, and DESA modification. DESA modification. Done. Station is finished.
No investigations?
Sorry? No nephrologist will do ultrasound scan. And yes, you can do. You need referral because we'll need to do further investigation, like what? Scan in your kidney, like we'll check further markers for the kidney, and nephrologist will do further. Yes. Okay. So The management is senior or not?
Yes.
Investigation further will be done by nephrologist. Medication, review medication, data modification. Station is finished.
Should we stop the medication?
Sorry? No, review. Well, you stop and you give something else. That's the meaning of review. Review medication.
Okay.
Is it easier?
Yes.
Just question in front of you. Read the question outside and make the story chronological. That's what I would say. I don't need to look at the question again. I would say, okay, Larry King, he went to the clinic. They found the blood pressure. They gave him medication. Then he came in the first follow-up. Blood pressure is still high. Then the second follow-up is still high and EG4. So, hi, Mr. Larry. I can see from my note that you went to that. Well, why, Mr. Larry? What happened? Yes, doctor. I went and they told me blood pressure is high. Did you have any symptoms, Mr. Larry? Like headache, blurred vision, chest pain? No, doctor. Yes, doctor. Did they give you anything, Mr. Larry? They gave me medication, doctor. What medication, Mr. Larry? Ramipril, doctor. Did you use it as it was prescribed? Yeah, doctor. Yes, thank you very much, Mr. Larry. Mr. Larry, in your first follow-up, your blood pressure was quite high, Mr. Larry. Well, even though you were on medication, other risk factor could be the cause, Mr. Larry. So it's all right if you have a change of lifestyle, Mr. Larry. Diet, exercise, smoke, and alcohol. Mr. Larry, in your second follow-up, EGFR was low. Yes, doctor. Which means, do you know what EGFR is? You have to assess. You have to assess. You have, this patient should know what EGFR is and should know that all the blood tests were normal. This patient should know that all the blood tests that were done were apart from EGFR. So EGFR, Mr. Larry, was low. Do you know what EGFR is? He will say to you, no, doctor, it's a kidney marker. So it's okay if I ask you some questions to make sure that the kidney is not failing. Then ask the question for. Then you can say to him, Mr. Larry, any medical conditions? Are you normally fit and well? Any health issues? Is it okay if I examine you? General physical examination, provisional diagnosis. Blood pressure could be problem, lifestyle. The kidney, the fact that the EGFR is low, it could be the blood pressure itself, or it could be. So, senior, review medication, further investigation, nephrologist. That's it. Now, can I give in this station provisional diagnosis? Renal artery stenosis. No. You think logically. No. Think what? Logic. FY2 in a GP. Someone is coming. No. You need a genius FY2. Seriously. What did I think it's? No, because that in the scripts, you think about it. Those are all doctors. We are all doctors. You think about it. This case in a GP, can you give him diagnosis renal artery stenosis? You can't. All scripts said renal artery stenosis. You can't. All scripts said bradycardia is Stock Adam. If you know any cardiologist in nephrology, you cannot diagnose it over the counter. That's called over the counter diagnosis. That? Seriously, that's over the counter diagnosis. Anyway, let's move on. I think we should wrap it up and move on. Yes. Because I'm getting and headache and you are tired, so we don't want to stop there and just ask 100 questions and then I lose my energy and then
Dr. Mo.
No question, please.
Dr. Mo,
any question in the group? No questions now. Please ask the
just
questions.
One question, Dr. Mo, please.
Please,
yes,
Dr. Mo.
Patient was using Viagra in last scenario. Was it because of the erectile dysfunction due to high blood pressure or something else?
No. The erectile dysfunction, I was trying to make a joke with him in the station. And Viagra is a risky factor, yeah. It's a risky factor.
I took it very seriously, no problem. Thank you.
Yeah, it was just a joke, yeah. Anyway, so next station. Guys, I'm sorry again if I say to you don't ask questions, but I care about you. And I know that the questions will not benefit anything after we break down the station, like. So there's nothing we can. Okay. Online doctors, are you benefiting? Anything you're adding new to your knowledge?
Yes, very benefiting.
Unfortunately, if you miss the online mock, the course is not complete. So you can only blame yourselves, because online mocks is to add anything that cannot be done in a video, which this cannot be done in a video. I cannot just talk to myself, and this cannot be done. Yeah.
Yes, this
So
is a nutshell.
Sorry?
I said this is a nutshell.
This is the olive. Nutshell is a. Did you pass IELTS or OET? I think IELTS. Nutshell. Even the way she pronounced nutshell, she's like coming from the Buckingham Palace. Nutshell. Doctor, where are you from? Where are you from? Your English is, the accent is authentic.
I'm from Sudan.
Wallahi Azol, I know from Sudan. Sudan, I know. Wallahi, you feel it. You feel where the accent is come from. Wallahi, bint النيل. Okay, next station is okay. Let's choose some of the doctors. Yes, guys, are you okay?
Yes.
Are you getting anything from the session?
Yes.
Yeah. Okay, so I will choose one of doctors here. So it's all about understanding the question. End of story. Dr. Danny came out, blood pressure, Viagra, وكده, وفinish. Thank you, gone. No EGFR, no. And please write down, guys, write down. Very important to explain the result. Very important to say the blood were okay. Apart from something called EGFR. Do you know what EGFR is? Explain it. Very important. Very, 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 very important. Okay. We need to choose one doctor. Dr. Nihal. Dr. Nihal. Do you know what station with me? I know. Do you know what station, Dr. Nihal?
Of course. I'm intimidated, but I will.
Sorry?
I am
What you say?
intimidated, but I will do a station with you, doctor.
What you say? Intimidating. 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 Okay. Write down the question. Write down the question. Okay. All right. So 22 years old. 22 years old. Do you have a famous Indian actress? Female Indian actress. What's her name? Everybody was smiling. What's her name?
Kareena Kapoor.
Ashwarya. Ashwarya what? Ashwarya Rai. So 22 years old, Ashwarya Rai.
Kareena Kapoor.
Yes, write down. Because that's the exam. The exam, you're going to find mix of names, yeah? So I want to give you difficult names. Why? So you can get used to. I'm sure yesterday in the mock, people were confused. Dr. Mo, I call that name different and I call that name. You know what happened? In the exam, you have 16 stations. I always advise people, the last thing to look at before you open the door is the name. Is what? The name. The name. Got 16 station. You are having Anthony Thompson, Andrew Ashwarya Rai, Alex Tony, Muhammad Sobhi, and then you end up by carrying the name from a station to the other. Because it's halfway through the station, you can call him Andrew, and Andrew is the previous patient. Seriously. Then you go to the third station. Oh, and then the patient remind you, my name is Tony Doctor. Then you go to the second station. You forget halfway, you call him Tony because it was the previous one, and you get mixed up. Was that Tony? Was that Andrew? So always the last thing to look at is the patient. Before you open the door to get in, look, Andrew, assalamu alaikum, and always start by his name. so you remember. So the first thing when you open the cubicle, hello, Mr. Andrew. Why do you do that? Because it's the last thing you look at the door. What is the last thing you look at the door? His name. And the first thing you call him with his name so you can remember it. And so you can start. Do you understand me? So that's what I do. I look at the door. When they say begin, so I look Andrew. When I get in, hello, Mr. Andrew. Why? So I don't forget. Yes, you can call the patient from the start. It's a confirm of identity. I don't need to say, can you please confirm your full name and date of birth? No? Yes. Hello, Mr. Andrew. Yes, doctor. Can you please confirm your full name, please? Andrew Thompson. But that way, I will take the name from the door, and the first thing I will say it in the cubicle, so I remember it. Rather than I go in, can you confirm your full name, and then because it's something of if you say it out loud, you will remember it. Rather than him saying it, then you will still forget. But when you go, so what is the last thing you will look at? What is the first thing you will say? Is hello, hello, Mrs. Rai. Her name is Rai. Ashwarya Rai. I have to look here because everybody is smiling. Ashwarya Rai, everybody is happy. Even Danny was happy. Ashwarya Rai. So, my name is Ashwarya Rai. I am 20 years old, 22 years old, coming to the clinic, GB clinic, because I have a concern. Okay. Wow. Seriously.
Yeah.
Is that Ashwarya Rai?
Yes.
Yes, that's why Danny was smiling. Yes, Ashwarya Rai. All in.
She was. She was in India.
Yeah. Okay, let's start, Dr. Nihal. Let's start.
Yes, doctor. I'm talking to Miss
I
India now, so I'm lucky.
I am Ashwarya Rai, 22 years old, okay? Yes, she's very good looking, mashallah. Let's start. Coming with a concern, okay? Guys, by the way, some stations, before I start, 1 second, before I start, some stations, they say 15 years old daughter with her mom, 22 years old with her boyfriend. Whenever, if it happened, and there is a patient with his relative, always take consent. Say, is it all right to take in front of your boyfriend? Is it all right, Alicia, to take in front of your mom? Always take consent, please. Yeah. Clear. So if you have a station where you have a girl, a lady with her boyfriend, her husband, always tell her, can you confirm your full name and date of birth? She confirm. Is it all right to speak? Is that? Can you please confirm that my husband, my partner, is it okay to have a child in front of him? Yes, it's okay, doctor. Carry on. That's the ethics of it, yeah. Because if she said no, he's gonna have to leave. But that doesn't happen. But it will look good because you show them that you know the system. It's all right if you have a chat in front of your boyfriend. Yes. Okay. So let's start, Doctora and Dr. Amr Sobki. He is having the DJ.
I'm here, doctor.
Yes, let's start.
Okay, doctor.
Yes. I'm ready.
I'm ready, doctor. But I can't see you. I don't know if it's my
You can't see me?
or no.
Okay, guys, can you see me?
Yes, doctor.
Yes, you can.
Maybe it's my internet connection.
Do you wanna get someone else?
No, doctor, I'm ready. Should I have to see you? Are you going to do something that I have to see?
Can you switch off the camera and switch it back again? On your camera?
I will. Okay, I will try. I can log out and then log back in.
Quickly. People are dying here. Wanna go home? Dehydrated. Wallahi.
But she doesn't miss out.
Yeah.
So that's why she just wants to know.
She doesn't, yeah. Guys, tomorrow's alarm mock, yeah? Carry on. You know, did you enjoy today?
Yes.
It could be tiring, but very beneficial. Very beneficial. It's one thing, alhamdulillah, it's only here. And it's one thing that helps people to pass.
And the idea is unique, you know, just think of something.
Inshallah, but in the new year, I'm thinking of new idea. Yeah. Tomorrow we are having the brand new mannequins delivered here. So all the mannequins that's here, but new. Okay? Antenatal, speculum, you know, the blood sampling, everything, catheter, new. So
I am back, doctor, and I can see you now.
Yes, perfect. Let's start.
Sorry. Okay, let's start.
What?
Hello. Is it Ashwarya Ray?
Okay. Yes, let's start.
Hello. Is it Ashwarya Ray?
Yes, it's me. How are you, doctor?
Okay. I am Dr. Nihal Youssef. I'm one of the doctors here in the GB clinic. Can I please confirm your age?
I'm 22 years old.
Thank you for that, Ashwarya. So how can I help you today?
Well, doctor, I just lost some weight and I'm very concerned about weight loss. So.
And can you tell me more about it? Like, was it intentional?
Well, not really. It's not really intentional, but I'm happy that I've lost weight. You know, it's my boyfriend who's not happy because he doesn't like skinny girls. So he just asked me to come to the GP to get checked because he likes me to have some meat. So he said, just go to the GP and check why you are losing weight. But I'm happy.
Okay, Ashwarya. I'm going to have to ask you some questions just to get to the bottom of it. Okay, is it cool with you?
Yeah, it's fine.
So can you tell me how much did you lose weight in the past couple of months?
Well, I think I've lost about 3 kilos, 4 kilos.
Okay, and how's your appetite? Do you eat well?
Yeah, I eat well. Yes, I have good appetite.
And how's about your what about your sleep?
Well, I sleep nice, fine. It's okay.
Do you exercise by any chance?
Well, I love exercise, but I exercise like not much really. I exercise like I used to do 3 times a week. Now it's like once a week.
What type of exercise do you usually practice?
Well, you know, running.
Okay, and for how many hours or minutes do you run each time, for example?
No, like 20 minutes.
Okay, that's good. Can I ask you about your type of diet that you are having? You told me that you have a good appetite, but what type of diet do you usually consume?
Well, fruit and veg, plenty of fluids.
That's good. And by any chance, have you ever had fever in the past few months?
No.
Have you ever felt sweaty at night?
Sweaty? Well,
yeah, some night sweat, something of that sort.
Well, yeah, I've been sweating recently more than normal, but I don't feel sweaty because I use deodorant and and perfume, and you know. So
well, that's good to keep it's good to keep your personal hygiene. I'm just checking your physical symptoms as well. Okay.
Yeah.
And what about any lumps or bumps? Have you felt any abnormal lumps and bumps in your body recently?
No.
Oh, okay. And Do you have any medical condition that are you diagnosed with by any chance?
No, I'm very fit and well.
And is there any family history of any medical condition?
No, everybody's fit and well.
Are you on any medications, even if it's on the counter or online or prescribed?
You mean over the counter?
Like, do you buy any unprescribed medication from the pharmacy, for example?
No.
Okay. Okay, that's good. What about your alcohol drinking habits?
Well, I drink alcohol. I love, what does she drink? Champagne. I love champagne. A bottle of champagne every weekend.
Okay, and what about smoking? Do you smoke anything?
Nah, it's not good for my teeth. It's not good for my skin. I care about my skin and my teeth. I don't like smoking.
Well, let me tell you that you look amazing. I wish if I had your skin.
Thank you.
Okay, Ashwarya. Just one more question that might seem a bit, odd or maybe intrusive. Have you ever tried any illicit drugs?
No, I don't.
Okay, that's good. That's good thing to know. What about your periods? Are they regular?
Sorry? You should. Sorry?
What about your periods? Are they regular?
My period is regular, fantastic. It comes every like 3.5 weeks. It's not heavy, no bleeding in between.
I'm glad to hear that. Are you sexually active by any means, Ashwarya?
Yes, I am.
Okay, and do you by any chance practice safe sex? By that I mean, do you use condoms?
Well, I don't like condom, this plastic thing. I don't like it.
Minutes remaining.
But I use contraceptive methods.
What do you use, Ashwarya?
Combined oral contraceptive pills.
For how long now?
For about 5 years.
Do you take them regularly?
Yeah.
When was your last period?
It was 2 weeks back.
By any chance, are you might be pregnant?
No, I cannot have a belly because I have a film very soon, and I cannot have a belly for the film.
So what are you doing for the job from your concern? I guess you are an actress.
Yeah, of course. I'm an actress, very famous actress. Famous, right?
Well, that I am lucky because I'm sitting with an actress.
Oh.
Okay, Ashwarya, I know that I might have been asking so much. I'm just trying to get to the bottom of it. So what's your main concern today?
My main concern, doctor, why am I losing weight?
Do you have any idea about what might be the cause?
I don't know.
Okay. And I just need to examine you if you don't mind.
Yes, what would you examine, doctor?
Well, I will be measuring your BMI. I'll be checking your observation at all, like your oxygen saturation, blood pressure, blood sugar. I will be checking your temperature. Is that okay with you?
Yes, doctor. Yes. Blood pressure is normal.
I'll do some blood test and urine analysis and urine dipstick.
Okay. Blood test is normal. Urine analysis is normal. Urine dipstick is normal. No problem. Nothing.
Okay, Ashwarya. If from what I have heard from you and from my examination and assessment of your case, I really can't.
Carry on.
I really can't find anything in particular that might cause you losing weight. but I will advise you to go to some more tests just to get the bottom of it. But I'm really worried about the fact that you are not worried about losing the weight rather than your boyfriend's opinion. So,
no, because for a famous actress, she needs to be sexy and slim. So losing weight is something good.
Well, Ashwarya, I think with someone as beautiful as you are, you will look beautiful and sexy in any weight.
Thank you, doctor.
What do you think about that? Like when you look at the mirror, don't you see yourself as a beautiful woman?
I do.
Okay, so why bother yourself with someone else's opinion?
Yeah. Right. But okay. Yeah. So what do you think is causing this problem, doctor?
Well, as I told you, well, I couldn't get anything from your history, and I couldn't get anything from your observation and examination. Like, to me, is everything looks normal. But I'll be getting back to my senior just to get to things more thoroughly. Maybe there's something I missed,
Okay,
and maybe he will ask for a
speak to your senior. Say, you know, I have a patient here. Speak to me.
Well, I have a patient who everything is normal, and she is worried about. She's actually not worried. She's happy that she lost about 4 kilograms in the past month, but her boyfriend is the one who is telling her to go get checked. But everything from her history and examination is normal.
How much weight did she lose?
About 3 or 4 kilograms.
Okay, 3 kilo, all right. How old is she?
8 pounds. 22 years old.
What are your differentials?
Well, I think she is might be on the.
Did you do thyroid function tests?
No, and I didn't ask about thyroid. I'm stupid.
Can you please go and ask her about thyroid, and please do thyroid function test and ask about diabetic symptoms, because she could be diabetic, weight loss, so diabetes or thyroid, and then come back to me, okay?
Well, I did a blood test and and urine, and nothing came for the blood and the urine.
Did you check the thyroid function in the blood? Did you say thyroid function test or just blood?
No, I didn't ask about the thyroid. Although she told me she's a bit sweaty.
If you don't, the exam say thyroid function test, you will not. By the way, I had the thyroid function test result for her ready. TSH, T4, I had it, but I was waiting what to say. Of course, you have to say thyroid. Okay, now there is. Thank you, Dr. Nahad.
Okay, I filled the station, right?
No. The main thing is we keep learning.
At least I got 4 IPS marks.
No, IPS, perfect. Then it's a bit deep. IBS marks. IBS 12 out of 4. Seriously, Ashwarya, you look sexy. Yeah, come on, Ashwarya. Look at you, Ashwarya. Come on. This is very common. Station. You see, Ashwarya. Okay, this is very common station, which is weight loss. Okay, by the way, she was trying to go to the psychiatric history. It's not psychiatry. This is not psychiatry. The fact that I'm saying to her, I'm happy I'm losing weight, everybody will be happy to lose weight. It's a normal thing you say. Well, I'm losing weight and, you know, I'm an actress, and, well, I mean, if you tell a lady, oh, lost weight, she'll be happy. Oh, really? You know, she'll be happy. She's not going to be, wow, you know, like, wait, what you say, you know? But if you say you put on weight, she'll be upset. Do you agree with me? So what I said, it was normal. I did not mean to confuse her. I said, well, I'm really happy because, you know, to lose weight is, she's not a doctor, Ashwarya. She doesn't know. But as far as she's concerned, if she is losing weight, it is good for her. It's not anorexia. It's not, you understand? No, nothing. Okay, that's why I choose an actress. Why to do this and to be like, okay, I want, you know, I'm happy to lose weight, you know, like figure and, you know, not for, because she's the actress. The other one, the anorexia, yes, my model is Ashwarya Ro. But this is Ashwarya herself. In the anorexia, she say, do you have any role models? Ashwarya. But we brought Ashwarya in the station. So Ashwarya doesn't have role model. It's not psychiatry. I hope you understand what I'm saying. It's a normal reaction of a female. Yes, I'm happy to lose, but my boyfriend is concerned, you know. Anyway, so I just brought this station to tell you about causes or a weight loss station. A station. How can I help you? I lost weight. Weight loss station. Okay. The structure. Is it counseling or medicine? Medicine. So can you write down P1, P2, P3 مفتوزة. P1, P2, P3 مفتوزة. Okay. P1, how can I help you? Doctor, I lost weight. Okay. Can you please tell me more about it? What do you need to know about the presenting complaint? How much weight did you lose? Since how long? For how long you've lost that much? So I lost 3 kilo in like 2 months. 4 kilo in 4 months. So how much? Since how long? Is it intentional? Is it intentional? Do you intend to lose that weight? So that 3 mandatory question. Sorry? So mandatory question. How much and how long? Because I could tell you I lost 1 kilo in 1 year. That's why we say how much and how long important. Okay, and is it mandatory or not? Okay. Is it sorry, intentional? Is it intentional or not? If it's not intentional, like this case, it's not intentional, doctor. No, it is intentional. I want to lose weight. Okay, I want to lose weight. Then think of anorexia, for example, bulimia. But no, I told her no, I don't intend to lose weight, but I'm happy that I'm losing, but I don't intend. I hope you understand. So if I said yes, I intend to lose, think of psychiatry. But if I said no, even though I'm losing weight, I'm happy, but I don't intend. Okay, anyway, so that's P1. What is after P1? What comes after P1? No. No. After P1,
differential diagnosis.
No.
Concern.
Anything else?
Aywa, who said anything else?
Naila.
Dr. Laila, perfect. Dr. Nihal, I wanted to give her plenty of symptoms. Heart racing, sweating. I was gonna give her diarrhea, but I didn't. Why? After exploring the complaint, she started saying, do you have this? Do you have that? So I was answering a question. Guys, by the way, I'm not a bad simulator. I'm trying to do what they do in the exam. I was answering your question. So you should have said, apart from the weight loss, is there anything else that you would like to tell me? Then, diarrhea, sweating. But if you close the question, do you have this? I will answer you yes, no. Yes, no. Yes, no. Yes, no. And that's it. I'm not going to tell you anything. So please, guys, after the presenting, anything else apart from this? I know I sound silly when I say these things, but it is important. If you don't ask the patient an open question, he will only answer your question. Anything else apart from this? And now you are expecting to be giving symptoms. Now I'm giving you a structure. I'm not giving you a station. So whatever symptoms he gave or she gives, after that, after the anything else symptoms, you need to ask the concern. What's your main worry? What's your main concern? Concern comes. You need to ask about her concern. Yeah. Any guys, I have 16 patients in the exam, minimum 16 concern. After the concern, you start with your DDs. Clear? What are the differentials for weight loss? Write down A, B, C, D, E. Write down E, Mo. Mo is my name, but before that, A, B, C, D, E. A, B, C, D, E. A, simple. Anorexia and appetite. Appetite. Is it a valid question? How is your appetite? No, if I don't have good appetite, I don't eat, I lose weight. And anorexia. But anorexia here, you're not going to ask about it because Early on, you will know. Is it intentional? Yeah, it's intentional. So here, because it's not intentional, if it's not intentional, you don't need to ask anorexia. Because I don't want to be thinking anorexia or how to ask. No. Okay. What does B stand for? TB. TB. So ask about cough. Okay. Any cough, any shortness of breath. Okay. TB. What does C stand for? Cancer. Any lumps, bumps anywhere in your body. Okay. Any bleeding anywhere in your body. Cancer, which is flows, in brackets, flows. Yeah. D stand for
diabetes.
Four things. How is your diet? Ask about the mood. Wow. Depression can cause weight loss. D, depression. D, depression. Do you agree?
Yes.
So diet, depression. Ask about any medications, like what? Guys, slimming tablets, for example. Any medication can cause weight loss. Yeah, water tablets, slimming tablets, yes. Okay. Anything else? Diabetes, perfect. Highlight the diabetes here. Make a circle. It's a very important differential in any weight loss. Very important. Very important. So how to ask about diabetes? But ask about symptoms. Passing urine frequently. Yeah. Thirsty. Feeling thirsty. Polyuria, polydipsia. Okay. A, B, C, D, E. E, endocrine hyperthyroidism. Highlighted. So two differential that Dr. Nihal didn't ask about are the two mandatory for me. Diabetes and thyroid. Sorry, doctor. I can see you're very tired. Sorry. We finished. This is the last station. Yeah. So, thyroid. BMW. Write down. BMW. What is BMW?
Bowel motion. Weight loss and weather preference.
Yes. So, bowel. BMW is the car. BMW car. B for bowel. Always diarrhea. M for mood. W for weight loss and weather preference.
That's for thyroid?
Sorry?
That's for thyroid?
For hyperthyroidism. Yeah, BMW. BMW are the symptoms. B, bowel, diarrhea. M, mood. W, weight loss and weather preference. What water do they prefer? Because they feel hot, they prefer cold weather. And the hypo is not our topic now. Hypothyroidism is the opposite symptoms. It is still BMW. It's not fat, it's not citron, BMW. Still. But the opposite symptoms, bowel constipation, mood as well, and weight gain, and weather preference, they prefer warm weather, yeah? Because they feel warm, they feel cold weather, yeah? So that's BMW. And finally is MO, mood. Always ask about the mood. Okay? Obviously, we know that hyperthyroidism, apart from BMW, we know the period, they can have period problems, late period, you know? We know that period problems as well, heart racing, but that's like basics. BMW, bowel, mood, weight, and other preference. BMW, okay? We have things like BMW will help you to just remember thyroid, BMW, you understand? So there is a medical condition that you can add as well, which you can add it in the, for example, with the diabetes, diabetes and malabsorption. As D, in D, diabetes and malabsorption can lead to weight loss. Yes. Is celiac, weight loss 100%, malabsorption. So you can ask about malabsorption, like stool difficult to flush, for example. Okay, ask about the stool. That's it. That's it. Weight loss. So two things not to forget in weight loss. If it's intentional, anorexia. If it's not intentional, in a young age, thyroid diabetes. In old age, cancer diabetes. Guys, this is the olive. So a patient is weight loss. Intentional or not intentional? Anorexia, psychiatry. intentional or not? No, it's not intentional. Old or young. So if it's not intentional, the age makes a difference. Is it old or young? No, old age. What's the differential? Cancer, diabetes. Young age, thyroid, diabetes. Clear? Lost? Guys, I'm giving you the highlights so you know what you're looking for, yeah? And because she's a female, always don't forget P4. P4 for many reasons. She's a female. I'm gonna give her medication for thyroid. So our case is thyroid. How can I help you? Weight loss. Intentional? No. You know the definition of thyroid, hyperthyroidism? The definition. Weight loss despite of good appetite. Yani, it's weight loss with good appetite. Thyroid. Weight loss with good appetite. Thyroid. So my point is, this case, how can I help you? Weight loss. Anything else? Explore it. Anything else? Well, diarrhea. Anything else? Heart racing. Weather preference. That's it. She came to you as thyroid symptom. Then you need 2, 3. How many differentials? All or 2, 3 differential? 2, 3. Top differential, diabetes. Second, the cancer, because it's still cancer at any age. Yeah, and then you can ask about diet, and then that's your differential. So maximum 3 differentials. But we know that young, top differential, thyroid, diabetes. Questions for diabetes: polyuria, polydipsia, thirsty, passing kilomolares normal. Now, when you examine, verbalize, examine, guys, is it clear?
Yes.
Yeah. Guys, I hate script. That's my way of teaching. Is when you go and read any script, it becomes very easy for you. Just look through it quickly. So even weight loss chapter, all of it, what I said, weight loss, it's all explore. Symptom, concern, DDs. However, between a station to the other, this DD, top differential cancer, diabetes, thyroid, you know. Okay, so examination. In thyroid case, if you're suspecting thyroid, what are the examination we verbalize? General physical, we need the neck, the eyes, hands. Neck, why?
The thyroid gland.
Eye, why?
Okay,
Rabies or hand. Okay, hand, they have tremors. Okay, something, sometimes clubbing, sometimes the finger called acrobacy, which is like you see, you know, here, you know, acrobacy. So that's why I said hand, eye, neck. However, in the exam, you don't examine, you just verbalize. You do not have thyroid examination. I will do like the doctors in the so far. Understand? I will be like the antibacterial. Not so far. No thyroid examination. Yeah. So you will just verbalize. 1, 2, 3. General, you need eye, neck, eyes, hand, neck. Okay. Now, provisional diagnosis. That's the whole structure. Yeah. I'm suspecting a condition in the gland in front of your neck. You see how simple I am? That's flap 2. There is a butterfly gland in front of our neck, responsible for what? The metabolism in our body. This gland is hyperactive. That's why our body is speeding up. That's the hypermetabolism. Your body is speeding up. That's it. So the gland in front of the neck, butterfly. This gland is responsible for the metabolism, which is the function. This gland is hyperactive. That causes the function to speed up. That's it. Management. If you forget in a young patient, young female, weight loss, thyroid, and you forget to ask about pregnancy, you fail the station. Fail? Yeah, fail. No doubt, if in my mock, I will fail you. And in my mock, I will fail you. I tell them, that's my mock. My mock, if you pass in the mock 11 station out of 16, you are a hero. Difficult. If you pass 11, 12 station, inshallah, you will pass the exam 14, 15 station. If you pass 6, 7 station in the exam, you may pass 10. That's, so the mock is difficult. Why? Because I instruct them. The mock, I put the stations. I pick the station. I always pick the difficult stations in the mock, so because you all do the mock. In the mock, every week I get the new stations that appeared every week, and I pick the most difficult from every topic, which is not the case in the exam. In the exam, it's a mix of easy and difficult. But in my mock, it's okay. This week, how many pediatrics stations we had? 5. Get the difficult one. This one is quite not common. Bring. So it's all the uncommon, number 1. Number 2, I instruct them. Guys, voice note before the mock, the day before the mock. Hyperthyroidism station, the female 22 years old. Listen, if they don't ask you about P4, if they don't do pregnancy test, and if they don't check if you are pregnant or not, fill the station. Khalas, done. Do everything else, but if you don't do these things, fill the station. So you come out, Dr. Mo, I only forgot this, and because I want you to remember it. My main concern is not the mock, is passing the exam. So then you picture this station, pregnant, khalas keda. Now I made sure you're not gonna forget pregnancy, Guys in anemia, if the station is anemia, make sure they don't forget the risk factor for anemia. Make sure they ask about diet, iron deficiency anemia. Make sure they ask about animal absorption, any blood loss. If they don't, fail them. That's our, And make sure when they give you iron tablet in iron deficiency anemia, they walk you through the side effect. It's a common side effect. Black stool, dark stool, tummy upset. Guys, if they don't do these 2 things, please fail them. That's it. Why? Because it's important. Melanoma, guys. Melanoma station, they must ask about sun exposure. They must ask about the change in the skin, risk factor, smoking, some beds, and they must, in the management, refer biopsy. If they see anything but not this, that's the core of any station. Anyway, but that's not the case in the exam. In the case in the exam, you can't forget antibiotics and sepsis, and you pass, fine. It's okay. It's not related really, but you need to be harsh. So in this station, pregnancy is a must. Asking about sexual activity. Are you sexually active? Do you use any method of contraception? Do you think you are pregnant? Is a must. That's in history. T4. As a thyroid, as a weight loss, as a 22 years old female. Now when you come to management, now we reached provisional diagnosis. We finished it. Do you know how to say about hyperactive? Guys, hypothyroidism is something else. Yeah? But a similar structure. What do you mean, Dr. Mo? Explore the symptoms. Symptoms, BMW. But BMW, the opposite. Do you agree? Hypo. And in the provisional diagnosis, again, same. Gland in front of the neck, butterfly gland, the metabolism. But this gland is, so the body function is, so you are too slow. You understand? You don't tell me you are too slow. But this is that, so the body function is slowing down. You understand? So this is the opposite definition, the opposite thing. So back to the hyperthyroidism management. You are in a GB clinic. Management. You will talk to your senior because you'll order some investigation. What are they? No, before the scan, guys. Before the scan. Thyroid function test. You wouldn't order autoimmune or scan unless you order thyroid.
We have done. I thought that we have.
Oh no, it's not written in the question. It was not. No. Now we're starting management. Have you mentioned thyroid? I did not. No. Start still. So thyroid function test. Yeah. Initial thyroid function test. Then the examiner will. Here you go. He will give you a paper or the patient. TSH low, T4 high, T3 normal. T3 can be normal, by the way. In thyroid, T4 is high, TSH is normal. Is low. So TSH is low, T4 is high. Then start by step 4, which is symptomatic. No, brother, we have your blood test here, brother, because it was provisional. Now you have blood test. We have done the thyroid markers. Always the examiner, when you mention investigation, the examiner will give you what? Please explain it, because who's that blood result? So tell him, the thyroid function markers came back, and it's showing that, yes, as we've spoken, that the thyroid gland is quite active. That's it. Tell him. So for that, I'll be giving you some medications. What medication do you give in hyperthyroidism? Carbimazole or propylthiouracil. Propylthiouracil if she is, but she is not. So carbimazole. Dr. Marwa, you're tired. I can see your doctors looking at me. Yeah. So carbimazole. If she's pregnant, what to give? But she's not. She's not pregnant. Carbimazole. When you take history on this station, don't forget, because in the history, I told you very important finding, but you must have missed it. I said she will have in hyper heart racing. I said palpitation. Did you remember? Did you write? I said to you BMW fixed plus. I said plus heart racing. You know. So in this case, ECG is a must, and beta blocker will be given. Again, what are the symptoms of hyperthyroidism? BMW. She will have palpitation. She will have periods. Very important. Periods. Very important. Okay. And then in this station, in the investigation, initial blood, ECG, and in the management, we're gonna give carbimazole and beta blocker. Be careful, because I'm gonna say something very important. Now we diagnose thyroid, we give her the medication in the GP. But what is the cause of the thyroid? Like the hyperthyroidism has causes. It could be what? It could be Hashimoto thyroiditis, because Hashimoto is hypo, but it starts with hyper. It could be thyroiditis. It could be anything. It could be cancer, Graves. I don't know. Autoimmune. So we will refer here. What is the step 5? So specialist referral to the endocrine, to the specialist in the glands, who will do further investigations. He will check some markers, immunoglobulins in your body, as well as a scan in front of you about the gland in front of your neck, which we call it, guys, the isotope scan and the immunoglobulins. But who will do the further? This patient will be referred to endocrinologist, not for diagnosis, for the cause. Why is she having this? Of course. So GP, start the medication. Start. But the referral for knowing the cause. Okay, she's hyper. Start her own medication. But what is the cause of it? Refer to endocrinologist to know the cause. So he will run further investigation, like scanning on your gland and further blood test. Would that be all right? Yes, doctor.
So, Doctor, over here, shall we say that he might do, or we will say that he
No,
will?
we will refer you to endocrinologist, where further scans will be done, or further investigations, like scan and other blood tests. Yeah. Finally, is safety netting.
Thyroid storm.
Sorry? MashaAllah. Thyroid storm. Pregnancy. And I want to pregnancy. I want to number one, guys, please. Number one, pregnancy. Number two, side effect of carbimazole. Yes, what carbimazole causes?
Granulocytosis.
So at any time you feel you get repeated infection, you get sore throat, you can come back to us, because this medication can decreases or can cause, or can be causing you to have infections. And then what doctor who said Chernobyl storm?
Dr. Subki ya باشا.
Yes, you understand? So before you talk about, the storm, you need to talk seriously. Basics. The medication side effect that you're going to give. I was just even given an example of the iron deficiency anemia. And that's when you give iron, say iron, can cause you to be constipated. The stool will be quite black, simple. So side effect of the medication and pregnancy. And then what Dr. Omar said. Understand? Storm. So when the thyroid is revoluting, so then, yeah. No, guys, be simple, yeah? Say what you want about. Say what is you at your level first. You know, when you apply for GP training, or when you apply for foundation training or any of these things like this, there is an exam called SGT, Situational Judgment Test. This exam, most of the exam is about what? Is about what do you do? And wallah, you will remember me with anything after you pass Lab 2, inshallah. About your level, this kind of your level. Your level. If you don't talk to senior, I mean, in the questions, if you don't bring a senior in something like, you know, serious, like, no, senior. Okay? I had an interview 4 days back. Okay, I passed the interview with the shorts and haraka, passed the interview. But during the interview, I forgot to mention that then we'll get a consultant opinion. And then he said, would you contact anyone? Seriously. Oh yeah, consultant. You. But I made it as a joke. I'll contact you. You understand? Like this, as a joke. Seriously. So we're laughing about it, and you know. So my point is, it's always wallahi, it was like this. You are the registrar in the department, and the patient is suspected abdominal pain was DKA station, DKA kind of clinical scenario. And then they actually said to me, so well, we'll do that 1, 2, 3, 4, 5, 6, 7, everything. And then, would you contact anyone? I remember, wallahi, you know, I'll contact you because they were the consultant. So I said, contact you know. So my point is, always remember, senior, always be safe, always work at your level, don't jump. So always your level. So always remember pregnancy before thyroid storm, side effect of medication before, you know. So these things is very important. So today we finished weight loss stations. We finished that kind of this structure. I don't know what you're gonna call it. You know, this kind of, you know, the medication side effect counseling. Okay, and usually medication side effect is easier than this. Usually a patient cellulitis and they was managed. You got amlodipine, ankle edema. That's it. End of the story. But this one is, you know, like life story, you know. Okay, so and that's relevant. That's relevant history. Don't even, you can't ask more because you have management. And we have done the angry patient, and we've told you the stations of angry patient. Yeah. Online doctors, thank you very much. Thank you,
Dr. Mo. What will we prepare for next week?
Dr. Omar. So far, we mostly done, you know. So let me look at the drive and see. But
okay,
anyway, guys, I will add this session to the course because it's important. Okay, and I don't want you to be sensitive. The course is getting bigger. It's no. This is important session, so I will add it in the course in case you want to see it in the future.
So okay? This will be included in the drive, Dr. Mo?
Sorry?
This session is included in the drive, Dr. Mo?
I will add it to the drive because I think it's important, guys. Yes. And I will also.
So Dr. Mo, my failure of
I will also add the ECG.
So when it will be in the drive, sir?
Brother, give me 2 days. I'll go home now, have something to eat, have a shower. Tomorrow I have work in the hospital, and then by the end of the day.
Sure.
Dr. Mo, can I please ask a question, please?
Yes.
So, Dr. Mo, you mentioned at the beginning that this patient was on OC pills for 5 years, and you are going to give carbimazole. Should I advise her regarding that, on to add another method of contraception or not? Plus, she is on OC pills for 5 years. Should I advise her because it's risk of malignancy, like for long period OC pills?
No. What you need to advise is the COCP. That's it. Nothing else.
Okay, thank you.
That's at your level. That's it.
Dr. Mo, I know it's irrelevant, but in HIV station, the partner has to know that her partner is having the HIV, right?
Yes.
But if she refuses, if she asks, like, please don't tell my partner the name that I'm having the HIV, but just tell him that you are in contact with the HIV person, is it allowed?
Yes, you say why, do you want to tell the partner, tell her about the risks of not telling the partner, yeah, and say it's important because he or she is at risk. So people at risk should be told. So at risk, the partner, surgeon, if they go to theater, Yeah.
Okay. Thank you.
No worries. No worries.
Thank you, doctor.
Guys,
Thank
have
you.
a lovely night. Have a lovely night. Wallahi, I look forward to that day when I meet you online, guys. Yeah. Enjoy. Have a lovely night. Have a lovely night.
Thank you, Dr. Mo. Thank you.
Bye-bye.
Thank you,
Bye-bye.
Dr. Mo.